Good afternoon and welcome to a very special half hour, which I wish we weren't doing because these are difficult times, but we're doing it for all of you and to keep you informed. We're fortunate that Arizona Governor Doug Ducey has agreed to join us, and we've done away with all commercial breaks for the next 30 minutes to get all of you the best and most up-to-date information and answers to the questions that you have been sending in. Dr. Kara Christ, the State Director of the Department of Health Services, is with us. She'll be answering our questions as well. And you can text in your questions right now to 602-444-1212. In the meantime, we want to get straight to the facts with a look at the latest numbers coming in today. The State Department of Health is reporting 665 cases of coronavirus. That's 157 more than we reported on yesterday. We've also recorded at least 13 deaths. These cases span across 13 of the 15 counties in Arizona. However, Maricopa County, not surprisingly because we are the largest, seems to be the hardest hit with 399 cases and 5 deaths. We are sitting a little bit further than we would normally sit to maintain social distancing for this roundtable discussion. Governor, look, you didn't have to make time for this to come down and answer these tough questions, which people out there, they're worried, they're concerned, so I appreciate it. When anyone in a position of leadership is looked to and counted on to lead and protect, you have that responsibility, and it's a great one. You've been very proactive this week, suspending utility shutoffs and evictions. The National Guard is out there helping the supply chain with grocery stores. Having said that, I think it's fair to say, and that all of us at this table can agree, that the time for rainbows and unicorns is over. We can't candy coat this situation. We have more cases in the U.S. of coronavirus than any other country in the world. And when we solicited questions from our viewers, the number one question seems to be that while other states have issued shelter-in-place orders and have been able to flatten the curve, you have not followed suit.
Well, we're going to be very vigilant in Arizona. We're going to be proactive. And this is my number one priority. It's Dr. Kara Christ's number one priority, and it's my entire team's number one priority. Our situation in Arizona is different than in other states. The guidance that I've put forward is to protect public health and people in the state of Arizona. I'm not looking to compete with other governors or to play any politics. I'm not guessing. Everything I've done to date has been in guidance with the Centers for Disease Control and Prevention and in alignment with Dr. Kara Christ, and that's how we're going to continue to do it. I think people should feel more comfort that I am surrounded by subject matter experts that are giving me good guidance, not only at the state level, but also at the federal level. I get to do video conference town halls with Dr. Tony Fauci and Ambassador Deborah Birx twice a week. That's how we're handling things in Arizona. We're going to continue to do it. Now, we've declared a statewide emergency around public health. We've issued executive orders. We've shut down restaurants and bars. I encourage people to please purchase takeout, and we'll continue to escalate as necessary and appropriate in the state.
I want to ask you, though, because I think, again, people depend on you and your team to keep them safe in times like this, unprecedented times. Is there a number of cases that you have in mind that would make you change your mind and issue a shelter in place for the state?
We will issue appropriate additional guidance as appropriate. It has to do with the number of cases. It has to do with counties. It has to do from the day of the first case, and in guidance with the CDC and the Department of Health Services. Every morning I consult with Dr. Christ, and every evening, and we've increased guidance as appropriate along the way. I'm going to use every tool in the toolkit. The governor is granted broad authorities in a situation like this. I want to do everything that's responsible and proactive. We're in a position in Arizona where we can actually plan and prepare for the future right now. That's what we're doing. Of course, schools are closed. It is very safe to be able to stay at home, to do the social and physical distancing is what I like to call it. Keep the 6 feet away from each other. But if you're not sick and you want to go out and go for a walk or do some of those things, that's also good for some of your health.
It is. Dr. Christ, do we have an estimate for how many actual cases there are versus every known case that we have in the state?
So right now we don't have a great estimate. We know that there are a lot of asymptomatic cases and mild cases that don't get tested, just like with the flu. So we imagine that what we're seeing is just the tip of the iceberg.
As a doctor, as a physician, taking off your hat for a second as the state director of health, do you think we came out of the gates as a country with enough urgency on this? Because at the very beginning, this was being downplayed and underplayed.
I think we came out pretty strong, especially with the travel restrictions and putting into place the screening at the airports. I think what we didn't understand at that time was how many asymptomatic and mild people who had already come by the time that we acted on that.
Of the deaths that we've had, at least 2 were not tested until after they died. Is that something that we should expect to see more of?
We will likely see additional deaths and probably people that are tested afterwards or even not tested at all but may have had respiratory symptoms.
A big concern that many of our viewers have had, and they've been writing about this, testing and treatment. And just because you get swabbed, and swabbing seems to be a problem for COVID-19, doesn't necessarily mean you'll get the results. State health leaders confirmed to us today that samples sent to the state lab need to be approved by the county that they came from or meet certain criteria to actually be tested. It's a situation the Moreno family in Phoenix knows all too well. Melissa has been quarantined in her bedroom for nearly 2 weeks, while her 2 young kids and her husband stay on the outside. She says that she was swabbed for COVID-19 on March 18th. When she checked back in with the hospital more than a week later, she was told that her test was discontinued. She went back to the hospital Wednesday after her condition worsened and was presumed positive by a doctor, despite having no test results. As you can imagine, not knowing has put a real strain on their family.
I've never felt so helpless, especially in the middle of the night when I hear my, our 1-year-old starts crying, and I just want to jump into action, but I can't because I can't leave my room.
And they are not the only family that's reached out to 12 News about not getting results. A woman in Tucson tells us her swab was actually rejected by the state lab. Another family told us they're still waiting on answers after a lab issue of some sort. Another tells us the lab said they have nothing for her at all. So, Dr. Chris, what the heck is going on here?
So there's a number of different avenues where people can get tested. If you're going to the hospital and you are not a high risk, which means you've had travel, contact with a specific case that we're aware of, you're likely going to a commercial lab. And so those results can take several days. We understand. We are prioritizing the limited resources at the state lab for those high-risk individuals.
We want to eventually come out of this. A lot of people have been told by their doctors, assume if you have temperature, cough, that you're COVID-19 positive, and those people aren't tested. How do those people, if they're not tested, factor into our state count?
So they won't factor into our state count because we only count lab confirmed cases, which is exactly what we do with influenza, and the messaging and the treatment are the same. If you have a cough, a fever, shortness of breath, if you can stay home, stay home. Make sure you take really good care of yourself. So lots of fluids, lots of rest. If your symptoms worsen or you have difficulty breathing, chest pain, that's when you should go into the emergency department.
It's no secret that when it comes to tests, they're hard to get, and swabs are hard to get. But even more concerning, I'm sure for all of us at this table, is the shortage of protective equipment for our health providers. Where are we on that, and what's the plan to make up the difference between PPE products needed and the amount we actually have? And I'd really appreciate if both of you would weigh in on
Well, I'll start. That's our top focus every day. We want to make sure that we reduce the number of illnesses that are out there. We save as many people as possible. We also want to make certain that anyone that's contracted the disease can be cared for and comforted. And we want to make absolutely certain the folks, the heroes that are on the front lines, the doctors, the nurses, the emergency medical professionals have what they need. And that's the gloves, the gowns, the masks, the ventilators, and of course the hospital capacity. So we've gotten the strategic supply to Arizona, 25% of it. That's what Dr. Chris and I went and helped unload last Saturday. We've ordered additional from the National Strategic Stockpile. In Arizona, our wave has not hit us yet. We know that there's community spread. We know that we're going to be dealing with this through April and May. But this is why I'm saying we're planning and we're preparing. All of these items are available today. I put out an executive order canceling any elective surgeries so that we could have even more more of these materials. We've had independent philanthropies and foundations. The Grant Verstandig Foundation donate 250,000 masks to the state of Arizona, acquired other materials in the private sector, as well as our supply chain catching up. But what's happening in New York right now and New Jersey and Louisiana is they are getting hit so hard, and they need those products. We are ordering those products, acquiring those products, and we'll be prepared.
Yeah, I wanted to point out this is not an Arizona-centric problem. It's a nationwide problem. But you have said that mid to late April is when you think the peak will hit. Will we be at 100%? If we're 25% now, as the governor mentioned, can we be at 100% by then?
So we'll have 100% of our supply from the Strategic National Stockpile. So we've already put in the request for the entire amount that Arizona is allocated. We will still need to get additional supplies, and that's going to take a little bit before the national supply chain is able to meet the demands.
And, you know, it's not just the masks. We keep hearing about the need for ventilators and the need for hospital beds. When this hits, and we know it will, it's inevitable, will we be ready to go as a state?
So, like the governor said, we are ahead of the curve here. So we are working on increasing our hospital capacity. So Governor Ducey issued an executive order that asked every hospital to increase its capacity by 50%. We've got the Army Corps of Engineers out here looking at how we can add additional capacity, both in ICU beds as well as low acuity beds. All of that will hopefully be in place by the time we hit our peak. Okay, I think a lot of people that are watching are reassured, and we want to remind you that this is a half-hour commercial-free, so we've got a lot to get through. On a national level, the House passed and President Trump signed today the $2 trillion coronavirus stimulus package, an unprecedented move. Team 12's Tram Mai is also with us tonight and has more on what the package means for millions of Americans. Tram?
Yeah, Mark, this is the largest economic rescue package in American history. The Senate approved it Wednesday, the House approved it today, and President Trump just signed it a few hours ago. So here's what's included in the plan. Millions of Americans will receive direct payments of $1,200 plus an additional $500 per child. The U.S. Treasury Secretary says we could see that money within 3 weeks. The stimulus package also provides an additional 13 weeks of unemployment benefits, plus an extra $600 per week for 4 months. Small businesses can also qualify for loans. Business owners can use that money to retain their employees. Now, Governor Ducey, on a state level, signed legislation today to support schools during closures. Under this new bill, all school employees, including hourly employees, will continue to be paid during the closures. Many parents want to know if you plan on extending the statewide closures past its current date of April 10th.
What we want to do in Arizona, of course, we want to get our kids back to school safely. We have them out of school or distance learning until April 10th at this time. And I really want to applaud Superintendent of Public Instruction, Kathy Hoffman. She's been a partner and a leader in bringing clarity to all of our parents. We're going to review that order in early April. We're going to make the right decision. We're, of course, going to work with our teachers, superintendents, and principals. There won't be any disruption in pay. We're going to figure out a way to complete the school year one way or another, but we want to do it in a safe way that protects our kids.
I was going to ask you, because when you look at the calendar with what Dr. Chris predicted and then this April 10th date, it may be a little bit early before we actually hit the peak. Do you anticipate having to extend that?
I don't want to guess on this. We're going to follow the facts and the data to do it. And it's not even April yet. We won't want to surprise people. We'll want to announce it as soon as we know. But I really do want to talk to Superintendent Hoffman and how we can communicate this and how we can best accommodate our children and their families through this issue. I will say, and you came on during the Red for Ed situation and propped up and supported the teachers with your plan. The teachers in this state have blown me away with the parades and the distance learning and the talking to the kids and how much they genuinely miss their students and how, I mean, it says a lot
about how far we've come in such a short time, I think.
It really does, and these teachers are heroes in this equation as well, and they're comforting our kids, and the ones that are able to distance learn, and some of the creative stuff that's out there, this closed, not closed campaign that Chad Gaston put out, and now others are following suit. There's a lot of good news stories. People are rising to the occasion, but like I said, we do want to see our kids get the education that they deserve, and then we're going to apply the proper flexibility on some of the things that are more prescriptive so we can get through this school year, take care of the public health part of this component, and bring back our economy.
We want to remind all of you watching at home this conversation is far from over, but as a quick reminder, you can find our complete coronavirus coverage on the 12 News app. You can also just text the word FACTS, F-A-C-T-S, to 602-444-1212. All right, Dr. Chris, let's talk about the weather. It isn't something you normally talk about, but we're expecting our first 90-degree day next week, and there is a belief that the UV light could help slow down the virus.
So viruses don't like being outside, and they don't like heat or UV light. So that will help when you've got frequently touched surfaces outside. One of the reasons that we believe we tend to see flu cases go down when it gets warmer is people are outside, less close proximity, and aren't sharing the germs quite as much. When we had the 2009 H1N1, we still did see a peak through the summer. So we would encourage lots of really good hand washing, making sure you're staying home when you're sick, or using a good hand base.
And that's probably one of many disturbing things about this is it's so new, novel, that we just don't know how it'll behave once the temperatures rise. And will it behave like the flu, or will it behave like other viruses?
Right. We just don't know that.
What about looking down the pipeline? We keep hearing about treatments possibly in other countries. What are you hearing?
So we're hearing that there's a couple of clinical trials going on with different types of medications. So antiretrovirals, similar to how flu acts, they've got medications. There's a couple of combination therapies that we're watching. I know New York is working on some of those clinical trials, as well as a vaccine.
You, no doubt, as a healthcare professional at the level you're at, along with other departments, run worst-case scenarios. When you run these scenarios and you talk about pandemics, and a pandemic was predicted years ago that would hit the U.S., how do you feel about our equipment, our hard equipment, not the PPEs, but the ventilators and the things that are life-sustaining for people who are in compromised situations?
So we are assessing where we are with the ventilators. We have made a request to the federal government to get more. I would rather be over-prepared and not have to use things than under-prepared. But that's what public health does, and we are going to be over-prepared.
Do you have a hard number of the ventilators that you think, based on our population, that we'll need?
So we made a request for 5,000 ventilators. We think it's somewhere around their worst case scenario, but that's for us to worry about, and we are going to continue to see how this unfolds. It's rapidly changing every day, and we're hoping, based on data from around the world, it'll be a much better scenario.
And Mark, that is what we're planning for. We're planning for a worst case scenario. That's what's prudent when there's a pandemic there. We have a lot of confidence and optimism that we can do better than that. And so when you hear about the number of ventilators, the fact that we're going to build 2 additional field hospitals in Maricopa County, 1 additional field hospital in Pima County, that I've called the National Guard up to help with that we've got the Army Corps of Engineers here. That's all to be in preparation if this is a worst case scenario. If we can mitigate this, if we can lower the number of cases, if we can stop the spread, I encourage people to stay at home, to social distance, to wash their hands, to cover their cough. All of those things matter. If somebody doesn't have this today, they can avoid getting it. If they do get it and they're young, they're likely going to get sick and get better, but are they giving it to other people? And of course, the people that are most vulnerable, the people that are 65 and up, the people that we love and care about the most, we want to protect them.
It is interesting because heading into this situation, Dr. Christ, we all believed that it would be that 65 and older demographic that was most affected by this. And what we've seen is it's been the 18 to 39 group.
So they are our most tested group, that 18 to 39.
Is that why the
that's
numbers
why
don't
those
jive?
Numbers, yes, so that's why those numbers don't jive. So the ones with the serious complications are in our 65 years and older, and then those with underlying medical conditions. But for some reason, we have a lot of younger people who want to go get tested.
All right, we want to check back in with Tram.
Ducey just touched on this very topic. It's a race against the clock as the state scrambles to find new space for hospital beds to treat what's expected to be a surge of coronavirus patients in the coming weeks. And Arizona is getting help from the U.S. Army Corps of Engineers. Team 12's Joe Dana has more on this tremendous task that they are taking on in Arizona and really across the nation.
The motto of the U.S. Army Corps of Engineers is "Let us try." A fitting motto because, look, it's a challenging time. This is about trying to make the best of limited resources. The federal agency, known for engineering feats worldwide, has representatives here at the Old St. Luke's Hospital. The hospital is shuttered. The Corps is evaluating what kind of repairs and upgrades would be needed to convert it into a coronavirus treatment center. The Corps is also surveying an orthopedic medical center in Phoenix that's currently used for patients with sports injuries to get surgeries and physical therapy. Across the country, the Army Corps of Engineers is not only converting medical facilities, but sports arenas, hotels, and dorms into COVID-19 treatment facilities. Take a listen to the commanding general of the U.S. Army Corps of Engineers describe the sense of urgency they feel to assist all 50 states.
But the bottom line is we've got to do something very, very quick. Most of the governors are saying that their peak is somewhere around the middle of April. So this does not take all the time in the world to do it. This is what is just barely the most important things we have to do and to be able to come up with a good enough solution.
Now, in Arizona, the goal is to double capacity in the state from about 17,000 beds to nearly 30,000. The State Department of Health is scouring other buildings as well that could be used for COVID-19 patients. Existing hospitals are doing their part, planning to convert other areas of their own buildings for patient care. For example, surgical rooms and recovery rooms could be used for coronavirus patients. Needless to say, the next couple of weeks will be crucial with close partnerships between FEMA, the state governor's offices, departments of health, and private contractors. And to give you an idea of other projects the Army Corps of Engineers is taking on, in the state of Washington, where the situation is much worse, they're looking at creating new hospital space in the rooms below the Seattle Seahawks football stadium. In Phoenix, Joe Dana, 12 News.
Joe, thanks. Governor, let's drill down a little bit further on this concept of makeshift hospitals. Where do non-COVID-19 patients go when this hits?
Well, the first focus is going to be around the COVID-19 patients. But what you heard Joe Dana say in the report is the different options that we have, this surge with the Guard and the Army Corps of Engineers, in addition to the fact that nobody's in our hotels and motels right now. Nobody's in our college dormitories. We have a lot of different opportunities. It's about that hospital capacity, but also making sure we have the professionals, the physicians, and the nurses. If you have an available hospital bed and you don't have a medical doctor there to tend to the person, the bed isn't worth a lot. That's why this logistics, this planning, and thinking ahead is what we've been working on since we had our first case.
All right, so we've talked about the hardcore materials, the ventilators, the beds. And the governor brings up a great point. What about personnel? Do we have enough personnel, Dr. Christ, in this state, doctors and nurses who are absolutely vital, to care for these patients and the non-COVID patients when this hits?
So we are working on identifying all available resources because we know doctors and nurses can also get COVID-19. And so planning for contingencies, working with the medical boards to see if we can bring back retired physicians to do telemedicine, working with anesthesiologists and outpatient surgeons to see if they can come in to provide care. And so and working with the Army National Guard.
And the same with nurses?
And the same with nurses, yes.
And physicians that are working in private industry, that are working in labs, to bring them back into the operating room to care and comfort for people and patients.
Well, I'm sure that at least in part, this is what they signed up for when they went through the rigors of nursing school or medical school to face a situation like this. I want to talk about economics because
Yes.
That is also on people's minds right now. It's a terrible time, not only on the health front, but also on the financial front. We know because we hear it every night that people have been hurt by this, and yet we see story after story of price gouging. Arizona still doesn't have a price gouging law. I know you've talked about Attorney General Mark Brnovich handling a lot of this, and he's been empowered, but isn't it time to look at some sort of a law to put on the books, to put more teeth into this so that people don't try to charge $50 for a roll of toilet paper in a time like this?
Well, I think we want to do everything we can under the law and every tool that we have to protect Arizonans and the people inside our state. I want to say probably the best advice on a day like today is if you can, stay home. If you do go to the grocery store, go to the grocery store and buy a week's worth of groceries for a week's consumption. There's a very real fear out there. People have high anxiety. But how many times can you buy 6 months worth of toilet paper? And that's caused these outages. That's why I had to ask the brave men and women in our National Guard to come restock our grocery store shelves. It typically takes 2 trucks to restock a grocery store. Mark, it's taking 12 trucks. Now, there's a lot of job opportunities available in distribution. I know a lot of good Arizonans have been hurt through this downturn and disruption, but we're going to get those shelves restocked. I have a lot of confidence in our supply chain and our great American manufacturers.
I'll tell you, if God forbid anything like this ever hits again, I pray that the Bashas of the world and the Fries will put up a sign on day one. You're limited to a week's supply.
I think that's just common sense.
Yeah, because we've learned the hard way that people are going to hoard. Let's talk about tourism. We know it's part of the lifeblood in the economy of Arizona. The Grand Teton, Yellowstone National, they've all closed. We've received quite a few comments from people who say they have driven up to the Grand Canyon to get away for the day, to clear their minds, and they see people from all over the country enjoying the view. God bless them. But we know they could be carriers. As painful as it might be, because it's one of the wonders of the world and it's one of our calling cards, as painful as it might be, is it time to shut down the Grand Canyon?
We need people to practice social distancing, physical distancing. There's no better place in the world to practice that than in the Grand Canyon. And at the proper time, with the guidance of the CDC, like I said, we'll make any decision that we need to make to protect public health. But I'm not going to shutter things that won't protect public health.
What about the fact that we know for a fact that people from New York, the epicenter of this right now, the hot spot in the U.S., are going to Florida and they're coming to Arizona? Is there anything as the governor that you can do? I mean, you can get a $30 flight from LaGuardia to Phoenix right now, which in normal times would be great. Is there anything as governor that you can do to prevent people that are infected from coming into the state?
There is, and we're researching what's going to be necessary on that front.
All right. I'd be lying if I said this was not a scary situation. I have the same anxieties that all of you do, and I worry about the collateral damage that we will find when the clouds lift. Governor, thank you so much. Dr. Chris, thank you. In the days and weeks ahead, we know there will be a lot of temptation to point fingers and place blame, which will only hurt an already painful situation. I know it sounds corny, but now more than ever, we have to stay together. We just have to find a way. Just as our grandparents and great-grandparents did years ago, if we join forces, we will get through this together. And we want to thank all of you for putting your trust in us, especially now during these times of uncertainty. For all of us at 12 News, stay safe and healthy, wash your hands, and we'll see you back here for 12 News at 6. And just a reminder, you can always get the most up-to-date information surrounding the coronavirus on the 12 News app. We'll see you back here in a half hour.